Hello. Thank you for joining us today. This is Nurses Talk 101, and it is nurses talking with nurses about nursing, about a curriculum designed by nurses for nurses. And I'd like to go around. Can everyone please state their name and their job?
Sure. I'm Karen Chastang. I'm the Chief Nursing Officer at Baldwin Health.
I'm Yulan Huff. I am the Director of Outpatient Surgery, Pain, and Infusions.
I'm Kristy Jones. I'm the Director of Nursing at Baldwin Health.
And I'm Jason Robinson. I'm the Director of Emergency Dialysis and Special Procedures.
So how do you envision working in the healthcare field currently? How do you envision the needs of the evolving healthcare system, and what are those needs?
I see really the needs at hand currently, the nurse's role really evolving based on the data that now we can collect, also the technology that we have to monitor patients remotely. I think that is ever evolving. And I think it's so important that we stay up to date and abreast of all the things so we can offer our patients better care now and also in the future.
Other thoughts on that?
I agree and want to piggyback off of what Karen said. Not only the part that the nursing uses technology to help, that helps the patient as well because they can access many things from home now, and so they can have questions answered in a more timely manner. And then the nurses, on the other hand, they provide services via e-chat, over the phone. It's so much different than the way it used to be. You'd have to go to the doctor, wait for an appointment, follow up and find out your results. Now everything is right there at your hand and you can find out more information in a quicker time frame.
I would also have to add an addendum. It's definitely technology for my department and access. Access in this area has grown so much. Technology-wise, I can provide faster, safer, and higher quality care with the new machines that we have at the hospital. So when you break it all down, from the moment that the patient walks in the door to the moment they're discharged, everything's streamlined.
Mm-hmm.
So.
Well, that brings me to ask a question about nurses on staff needing and pursuing education beyond their RN. So there's a lot of complexity associated with technology. So do you see the benefit of nurses going beyond their RN with their education?
Absolutely. I think it's very much needed. You can never have too much education. You can never overly educate, especially with the way that technology is advancing so quickly now. Being able to prepare yourself and give yourself the skills and the tool set that you need to provide better care for your patients, to have better patient outcomes, it's definitely needed.
It also helps for leadership to be better leaders. They get the best of the best, evidence-based, things that work, things that haven't worked, and they can go to their staff and say, hey, this is what I've learned. What do you think we could do with this information to help us in our current situation?
You know, technology is a theme that I'm hearing from nurses, and here at Columbia Southern University, the College of Nursing Health Science offers, informatics and data analytics and those things that are important for nurses to understand to work within those field of technology. So it's nice to see that you're seeing the advancements of technologies, and it's only going to grow in the future. So when we think about challenges in nursing, and we certainly have faced a few over our careers, what are you seeing at Baldwin Health as far as challenges, and how do you think education could address some of those challenges?
I think the nursing shortage, staffing is a big challenge for everybody nationwide, and if more nurses, more people are willing to go into nursing as a field and they get into it and really see what it can do for their community, it will be very beneficial for everybody as a whole.
I think that's what I'm most proud of with my team. The challenges are really operational for me at this point. I mean, I've been a nurse 30 plus years, so I've seen a lot of different challenges in healthcare, not just in nursing, but healthcare in general. And really, the technology has taken us and allowed us to have the data and the transparency. You know, it really does create transparency within your organization. You can monitor your quality metrics. You know where you stand. You know where you need to focus and improve. So my team is very much data driven. We look at the numbers. We're all competitive by nature, I think. So we look at those numbers, and that really drives us. And education, as Kristy was alluding to, you can never have too much education, right? Mm-hmm. But when a nurse seeks out that extra step, going beyond getting just a license, an RN license, it lets me know that they're really committed to going that extra mile, and shows that, you know, they really have a true interest and a true desire to gain more knowledge and to get the knowledge that you know, to the best of their ability, to be able to care for their patients and also for our community.
Thank you for that. Yes, I agree.
That segues pretty well into a question that I have about advanced degrees such as a BSN or an MSN, and what you find how would that impact the nurse and their potential leadership opportunities and growth within an organization, obtaining those degrees?
Absolutely. I think some of our positions from a leadership perspective, the qualifications, an advanced degree may not increase the quality of bedside care that a nurse provides, but I think having an advanced degree allows us as a team to communicate better and do more interdisciplinary, as an interdisciplinary team approach to caring for patients. I think it allows you to really see outside the box and really gives you that extra knowledge base to be able to not just care physically for a patient, but care for that patient as a whole.
And their family, because the family is always a
Absolutely.
big portion of that.
Absolutely.
So when we're thinking about nurses and the traits that you'd like to see and what you'd like to see in your colleagues and future nurses, can you share a few traits that you're looking for when considering nurses for leadership roles or taking on leadership roles? I know several of you are in leadership positions. What are some of those traits that nurse leaders need?
Good listeners.
Listening is huge. Clear communication. You cannot overly communicate, you know, trust, but always verify, communicate to your team your expectations of things that you need. You know, you can't be a leader without having a good team underneath you and having those team members to work along beside you and letting them know, you know, what expectations are and what your goal is, and having common goals together. Communication is key for that.
I think another big one that sometimes people overlook is being able to say, we made a mistake, and how can we make it better?
Somebody I think that I look for in my leadership team, somebody that is not only inspired themselves, but can also inspire others. So somebody who's really, you know, inspiring, somebody who can be also democratic, somebody who can, as you mentioned, a good listener, somebody who can hear somebody's problem or situation and really try to help from a democratic approach, you know, look at ways that we can help and improve, but also take into consideration the whole situation, everybody's feelings, and let everybody contribute.
And that's so important in nursing that you found that it's a team approach.
Absolutely.
We're all in this together, and the patient is the center of the universe, but, you know, we all have to work together for the best outcomes. Thank you.
I think you nailed it too, Bonnie, when you said nurse leader. I think in today's world we get so caught up with managing things versus leading people.
Yeah, that's right.
When you pick someone and you grow someone who can lead a group of people, the possibilities are just limitless. You can grow your organization to the top tier very easily.
Yeah, that's a good point, Jason. Absolutely.
When we talk about leadership and technology and growth and the workload demands, I mean, obviously there's a lot of workload demands, not only on leaders, but on the nurses at the bedside. What kind of other technical issues or expertise do you think you are seeing or that there's a need for, like nursing informatics, things of that nature, for your practice? Like, you're all working in different areas of the hospital. So what other technological needs do you think you're seeing, skill sets you might need?
I think from a technology standpoint, again, like you said, there is a big need, and there's a big push for that. But having someone who can help streamline processes, you know, let's not do the same thing so many times. You know, we just went through a process where we did waste walks and what we could do to kind of decrease that, because it's a lot on the staff and demanding. IT is a huge part of healthcare now, so being able to have someone there that knows the patient's, health and can also help guide the staff on how to do it in the best manner is very important.
So when we're thinking about, and Karen, you mentioned earlier about, nurses exhibiting something more beyond having the RN, going that extra mile, and what that means personally or professionally of advancing your education and gaining that additional skills. I'm interested to know you all's experience with this, either personally or professionally, what that looked like to continue your education or want to pursue your education, or were there outcomes on patients, or you talked about communication earlier. Is that something that you learned when you went to advancing your degree or wanting to advance your degree?
I think the advanced degrees really open up a lot of your mindset to, like I was saying earlier, maybe see the whole approach to nursing from an operational standpoint, from a patient care standpoint. There's so much more that can be involved in nursing other than bedside care. We're seeing now where you can remotely monitor patients, where you have telehealth now. We're seeing all those things, evolving, and who's to say what the future is going to bring. But certainly going back and getting those advanced degrees allows you to maybe be ready for what's on the horizon, and in turn that really allows us to provide, as an organization, I feel like we can provide a better quality product and better quality care, which that's really what it's all about. It's about quality, it's about service, and you can learn some of that through book knowledge and things like that. But I think the advanced degrees really take it to the next level, and it opens your eyes and opens your mind up to really be able to learn about the whole approach to healthcare in general. And when you can envision that, and when you capture that knowledge, I think the sky's the limit then. You can really, it's all about not just advancing your salary, but it's advancing your job security and what you can really offer, and serving on legislative boards and things like that can really make a difference, not just within your community, within your state, within the nation. You have a voice, and the nurse's voice is very, very important. And I think education opens that box for you to be able to have a strong voice.
That was beautiful. Yeah. and we have lots of amazing, strong voices here. So thank you for reiterating that there's power in what we say, and what we say is valuable. And we should learn those things and be a part of the change that we want to create, and be part of the healthcare system, because we are vital to the healthcare system. So that's really incredible. Thank you.
To segue off of that, how do our nurse leaders here feel that your advanced degrees have helped with your own professional confidence and the work that you do?
I know when I started off with a 2-year degree, went and got my bachelor's degree. I wanted to be able to have opportunities. I didn't want to be denied because I didn't have a certain, degree for that, but also I wanted to be the best that I could be in my profession. And there's tons of evidence-based practice off of, decreased mortality rates for advanced degrees, and that's something that I wanted to be able to bring to the table for my community, for my job. But being able, I think one of the biggest things too, doing the advanced degrees, is collaboration with other students from across the nation. We got the tools that we needed, the foundation that you need to be able to perform in a leadership role, but being able to collaborate with other students who were in the program, of how they did things from their part of the country, or what they were doing in their hospitals with your discussion boards, and you're talking, you learn so much just from that, and that's not even part of your textbook. So it was very eye-opening you were able to actually bring some of those things that you learned back into the practice of your facility to help patient outcomes and increase quality of care. And I think that's the basis of why you do, go towards those kind of advanced degrees.
Any other perspectives or
I
experiences?
really think she nailed a good point too about collaboration. When you look at like evidence-based practice and advanced degrees, you see things from all over the country. You see different hospitals in New York and California. They all, for example, COVID. We saw some of the best results from other countries, like South Korea giving us some advice on how they would treat a patient during COVID. So collaboration and advanced degrees, it's the future of healthcare.
When I went back, I did so because I like to know things. I feel like if I know more about it, then I'm able to tell somebody else, and that person can then tell somebody else, which is what education is about. So for me, it was more about knowing something so that I can impact somebody else, so that they can improve themselves and probably their family or a friend. That was why I did it.
Yeah, and I'm a little bit of a unique situation here. I was an ADN. I got my 2-year degree, and then, first I got my bachelor's in education, then went back to nursing. But like I said, I've been a nurse 30 plus years, and I've been in the CNO role only about 3 years. So, and when I accepted the job and was offered the job as a chief nursing officer, part of the agreement was for me to go back and be enrolled in a master's program. So I'm currently enrolled in a master's program. So yeah. So and maybe looking to enroll in another master's program. But anyway, I just think every day when I meet the challenges, and it's not easy. Advanced degrees are not easy. But one thing I think that it's done for me as a chief nursing officer in particular has been, it gives me the confidence to know that I have that knowledge and that I can use my knowledge to be a better leader. So I think it creates a bit of confidence too. I mean, these nurses are just fabulous examples of going back and getting that advanced degree, and I know that they're committed. This group is 3 of my truly committed leaders that are willing to go above and beyond, and they're committed not only to us as an organization and to their patients. They're just, it's a huge, I think it speaks volumes for them personally. And there's very few. I think probably at our facility we have just a handful of master's prepared nurses. But that's always been something that we would love to have more of course, because I wish I could clone all 3 of them. They're great.
All 4 of you. I'll add you to that too, Karen.
Thank you. Thank you, Bonnie.
You're a keeper. And it's interesting when you said, chief nursing officer. So you wear multiple hats, and I'll tell you a little bit about my nursing experience. So I started as an LPN.
Oh, wow.
So my experience was starting as an LPN, then I got my associates in nursing, then I got my bachelor's, then I got my master's in nursing, then I got my PhD in nursing, and then I, got some other things. And each degree I taught, each degree I obtained, I learned, it's a ladder. I'm learning more, I'm growing, and things that I have learned now, I wish I would have learned at school, of things like finances. When we talk about budget and finance and policy and advocacy, so I know that was something, talking to our community members and others, that's what we included in our curriculum was budget and finance and policy and advocacy, because that's where healthcare is, and we have to wear those many hats. So all of our master's degree at Columbia Southern University College of Nursing Health Science, that's threaded in all of our curriculum, as well as our dual degrees, our RN to MSN, where you get the bachelor's and master's together, and less time and less cost than if you were to do it separately, because those concepts are important, as well as our undergraduate bachelor's. We need to know in our bachelor's degree how this works. We're part of the ROI of facilities, and we need to understand that language, be able to speak to it in a language that others can understand as well. So when we talk about education and advice we give to nurses, and going back to considering whether or not to pursue, should I go back and get that bachelor's or master's or beyond, what advice would you give to nurses who are considering whether they should go back?
I think education, I grew up, my mother was a single mom, and that's something that no one can ever take from you. You know, you're never going to regret going to college and furthering your education, no matter what degree program you choose. But choosing nursing as a profession, you've got to have a compassion for patients. You've got to, first and foremost, I think the foundation of that is wanting to help patients, you know, get better. And to do that, furthering your career is going to continue to help you do that. And what you spoke on about as far as finances and things in that nature, you know, you go to nursing school, you don't think of financial and the budget, but working closely with Karen and looking at, you know, the return on investments and things, decision making, you have to be able to choose programs that's going to give you the knowledge that you're going to be able to take and actually apply to your day-to-day task. And you will be able to do that with advanced degrees. And you'll be able to bring back some of those top quality things to your patients and to your facility that you work for, and you're never going to regret doing that. So I 100% support it. And I think it's a great thing to do for yourself and to be able to further your career with.
Yeah, I think it just opens the door. You know, nursing, there's just a lot of different avenues you can go in nursing, not just, you know, being an OB nurse or an OR nurse or an endoscopy nurse and all those clinical things. But nursing, especially in today's world, with the technology and all that, like informatics, and you can really just, the possibilities are really limitless. And if you have that degree, that really puts you a step above other candidates and things like that. You're really gonna, you know, improve your resume, but it also just empowers you. And like I was saying earlier, it just gives you that confidence to know, hey, I can speak to this. I've got the knowledge. It empowers you to really just, the sky's the limit with what you would like to do. So nursing is a little bit unique in that way. And the operational side, as I mentioned earlier, is a huge challenge in today's world. You know, you think about healthcare and you think about the hospital service and the services that we provide. You know, it's so challenging, not just the increase in the cost of supplies and equipment and salaries and wages and all those things, but you think about it, and our reimbursement is such a challenge. Yeah. So you learn all that in these advanced degree programs, how you can navigate and how you can make the best business decision too for your facility and your patients.
It sounds like what I'm hearing a thread is to invest in yourself.
Mm-hmm.
That
Absolutely.
no one can take it from you, and investing in yourself by continuing your education allows you to thrive not only in nursing but beyond.
Absolutely.
Thank you.
And investing in yourself, to take it a touch further, in that getting an advanced degree and in developing the curriculum for the nursing programs at CSU. It's a thread-through concept, multiple thread-through concepts are to find your voice, be empowered, share your gifts, share your skills,
Right.
Impress upon others that things have a positive end, you know, that we can work through any problem. And I think that all starts with empowering yourself with education, arming yourself with knowledge, finding your inner voice and your inner confidence, and growing beyond.
I think sometimes you have to kind of simplify it down a little bit for some of the younger kids. And I try to always, when I'm talking to a young nurse, I'm trying to think about if I'm telling my kid this, how would I explain it to him? So the other day I was talking to a nurse, and I told her, she's like, I don't know if I want to go back to school anymore. I'm like, okay. I was like, what do you think about like farmers when they plant, crops and they fertilize it? What do they do? And they're like, well, they're investing in their future, right? I said, so when you invest in your education, you're fertilizing your education. You're putting that extra effort in, so one day you can be a flower or you can grow to something better. I said, you can't just stop now. You have to just keep on that path.
Because you're no benefit if you just stay stagnant. We all have to learn so that we can help the patients. As technology evolves, the world changes, we have to change with it. Whether we like it or not, we have to change with it.
Yeah, and that allows us to help patients and each other.
Yeah. And I think that's the one constant thing in healthcare is change. Our patients change by the minute, if not by the second, and we're constant state of flexibility and what that looks like. And having that in mind at Columbia Southern University, our College of Nursing and Health Sciences, being that affordable, being flexible, being adaptable. I don't know if you've experienced or what your thoughts on, I'm, talking to nurses on whether they, want to go back to school. I think the desire is there. Sometimes I'll hear, I don't want to sacrifice my personal life to go back to school. And I understand that nurses are busy. They're very, very busy. And having that in mind when we developed the curriculum for our College of Nursing and Health Sciences, we don't believe nurses should have to sacrifice their personal lives to go back to school. In fact, we bring the classroom to you. It's 100% online, affordable, flexible, innovative curriculum, so you can balance work and personal lives and further your education seamlessly.
That's awesome.
It's a huge a scare for everyone wanting to go back. Do I have time for this? I have a family. I work a full-time job. So having that flexibility, availability to get on to do it, during your time is huge. And then also being able to have a resource from the teachers, open communication and access to them to help you continue your education, and being there for questions is very beneficial. And I know it's one of the main concerns with anybody's taking the leap of faith of starting back education, but once you get in there and you do it and you see the support you have from the colleges that you pick out, it's very attainable.
Yeah.
Affordability too, because everybody says, well, I can't afford to do that right now. I've got little kids or I've got new car, having it to be an affordable, accessible thing is really big.
As I mentioned, I got my bachelor's degree in education. My mom and my sister are both educators, and so education was very much a part of my home life growing up. I mean, so important. And of course, I thought I wanted to be an educator, got my degree in education, and then immediately went back and got my ADN in nursing. So I stepped it just like that, and did not intend really on being in this type of leadership role. I served as a nursing supervisor on the night shift for 10 plus years. I was a director of the orthopedic unit and helped develop that service line when our facility knew that was what was needed in our community. We have a strong orthopedic service line at the hospital, so I helped develop that service line and was over the orthopedic unit for a number of years, and really was maybe content in what I was doing, and I loved my job and loved my career, and really didn't see me furthering my education or the need to further my education at that point. And then our CNO, that had been our CNO at our facility for a number of years, took the job as our chief executive officer. So, and she is master's prepared and has her doctorate in nursing. So when she took that role, I was approached about becoming the chief nursing officer. And just from a qualification standpoint, I think it was preferred that you were master's prepared. And so they asked if I would be willing to go back, and I really didn't have to think about it very long. I mean, that kind of pushed me, into doing it. It really wasn't something that I felt like I wanted to do or needed to do, but it kind of gave me that push that I needed. And I certainly have not regretted it whatsoever. I mean, I learn every day, and it's not easy doing it, but I think, you guys making it affordable and attainable, able to do it all online, I think that is so, so important. And not only is the student coming to you, but you're going to the student. Mm-hmm. And I think that speaks volumes of your program. So that's kind of my educational journey. I'm still on it every day. So, yeah, it's good.
I was in my third year of college, and I was actually a major in nursing. And playing baseball, you cannot do clinicals. So to keep my scholarship, I had to change degrees, change paths, so I changed to chemistry. Ended up getting a job at a local chemical plant, worked there for 6 or 7 years, and just continued to feel like, I want to go back to nursing. My grandmothers are nurses. I have aunts that are nurses, cousins that are nurses. So at the tables every holiday season, I felt out of place. I'm a little chemistry nerd over here, and they're all talking about nursing and all this fun stuff, and I'm like, I can do this. I can go back to school, and I continued to notice it was just another step, but also it opened a new pathway. So I went back to school. I worked night shift for Friday, Saturday, and Sunday nights for a couple of years to finish up my bachelor's in nursing at USA. Actually applied for a master's program, got in, and never started. So now, today, I'm sitting here thinking, I'm ready to go ahead and probably start that next journey. After 8 years of college, let's go ahead and get that master's now.
We may need to talk to the admissions.
We
Can we line that up?
we have 3 different masters, Jason's just waiting for you. You
Absolutely.
take your
Great.
pick. We can line that up today.
I actually worked Friday, Saturday, and Sunday nights at the plant, and went to school Monday through Friday. So I was always leaving Monday morning from work, going to school, and leaving school Friday evening, going to work.
Wow.
Oh,
I was
wow.
very fortunate to have some good friends and staff that always were like, you go study, go sit in the office. We got this. I'm like, thank you. So
Yeah.
very blessed with that.
So I have a bachelor's in science as well. At that particular college, I was doing some research on cancer with fungus. And then all of the talk about military started. My dad had been in the military already, so I knew about it. We were pretty much a military family. And so it was kind of like I had to do it when I saw the towers falling on the news that day when I came in from class. I was like, yeah, I'm going to do that. So I did that. Then I told my parents. I went overseas. When I initially enrolled in school, my degree was going to be in medicine anyway, but I wanted to be a doctor. My friend and I were both going to go to medical school. We're going to be some type of doctor. Well, when I came back, my whole vision changed about that. And I don't know if it had something to do with traveling to several countries and seeing a lot of things, but then I wanted to be more at the bedside, more impactful to people, because apparently for some reason people think I'm a good talker. I'm very good at talking to people, and they hear me and they understand what I'm saying, and I can impact something in their lives, even though I don't realize I'm doing it, I some kind of way do. So that was why I chose nursing, and it was a very funny story. So the school that I went in to get my AD in, this was the very last day for enrollment. I put my application in and I got in the very last day. So I was like, oh, I got to do this. So I kept on going. And then it took me 4 years before I got my BS in. And then a few years after that, that's when I got my master's. So I told my husband I was going to continue, and he was like, and your youngest is how old? So maybe one day, but yeah, I like knowing things.
I started out on the floor with my ADN, working night shift, became a charge nurse. At the time, my director was going out on maternity leave, and they had approached me to do an interim role while she was out, which was crazy. So we did that, but it was very eye-opening seeing the other side of not just patient care nursing. So that initially sparked my interest in leadership roles. There was a lot of things that I learned doing that interim role that I thought I need more knowledge to be able to know what I'm talking about and what I'm doing. So I went and I pursued my BSN degree. Took assistant director role sometime later, and really liked advocating for nurses and bedside nurses. You know, patient care is what drives us all. Again, it's the basis of why we become a nurse. I feel like it needs to be anyways. But also being able to advocate for the staff that you lead, to have the tools that they need, to be able to provide the best patient care, really pushed me to continue into a master's program too, to be able to make those decisions and be the best leader that I could be in order to get the tools for the staff that, you know, I had underneath me. So, and it was so beneficial, you know, again, to being able to know the things that you need to know to make the decisions, to be able to understand the financial impact, to be able to understand how to lead a team, how to be a transparent leader, how to advocate, again, for the staff. And the program that I was in was good. It was flexible, but I had a daughter at the time, a full-time working Monday through Friday, but it was very nice that, you had your weekends, but I didn't want to take away from my weekends for my family, so it worked well for me. We're getting up early in the morning and working on your assignments before my daughter would wake up, so when she woke up, she didn't think, oh, Mom's at school again, so, but yeah, that's kind of how it led me to get my master's degree.
And I can say Kristy practices just what she has learned every day. That is her, that is, I see that in her, and she practices what she has learned with her knowledge. I mean, she advocates, that's truly what she does and is very good at. She advocates for the staff every day. And more so really than I do. I get caught up a lot of times in the operational side and doing things out in the community and community outreach, and all those things are important, but Kristy really is in the trenches every day and really, really advocates for the staff. And I can see in Yulan, I'm going to tell something on Yulan, her servant's heart, and that's something you mentioned earlier about things that we look for as, for leadership. Jason's got a servant's heart too, as well as Kristy, but Yulan is she has a unique situation, and we've all worked together for so many years. Yulan has 2 precious children, and she won't mind me sharing that are adopted. And so she really, when she talks about her love for nursing and caring for others, she lives it every day too. And that's what makes me, love these people as leaders and really know that that we have a great team.
I think while nursing is based in evidence and grounded in evidence, and it's funny because that's what our practice is built upon, there is no one best way to achieve these goals because we all come at it at an individual manner. So that it isn't a one-size-fits-all on how you get your education. We all enroll in a class and that process is the same, but we all have to manage something very different in our own home lives. And realizing that you can time manage, you pick the right program, you can time manage, you can plan, you can bend things and mold things around what you need to get done for all of these aspects in your life. Even if it's sitting around the table, as I used to do with my sons, and we called it homework time. I had homework, they had homework. Let's sit and do our homework. We talk about the remains of the day, laugh a little, do some work, and it was a way to bond over something that no one really felt like doing at the time. But it was a way to bond and find a way through it. And I think nurses are especially great at seeing their way through a problem than to a problem.
Yeah,
With the price of everything increasing now, it's a financial strain on everyone, I feel like, at this time, but being able to afford education, I think is a huge decision point with some people and how they decide, hey, this is for me, or I can afford this, or I'm not going to put my family in a financial strain trying to choose between providing and then furthering your education. Mm-hmm. So having the affordability of advancing your degree is one of the biggest decisions, I feel like, in someone who's trying to decide, should I do this or not?
And I think utilizing your resources and doing your research and looking at your program here at CSU, you guys have, advisors and counselors available that can help you, reach those goals financially and, from an educational standpoint. So I think doing your homework early and doing your research, we as a hospital offer, some scholarship opportunity. We offer tuition reimbursement, things such as that, loan programs and things like that through our corporate office and different things. But I think doing your homework and doing your research and knowing the program, and you guys, like I've heard today, it's great. You've got a lot of resources and a lot of people available, to help an individual walk through the process and know what the challenges are going to be, but also know that you're going to have a team there to support you. So kudos to CSU.
For me, I utilized my GI benefits, and that is huge, huge. A lot of people don't know what they have, but it is there, and they should really use it.
Having a guidance counselor too to tell you that, hey, you qualify for this, tap into these resources to help guide students to say, hey, this is attainable, it's affordable. It helped me because I did not realize the things that are out there for nurses because there's such a need. There are a lot of resources, and having someone at a university to guide you on what those resources are is extremely beneficial.
And I would say, you mentioned something, Karen, and Jason, we'll talk later. You'll be our first student.
Yeah.
You're in.
That's great.
No
That's great.
exam you have to take. You passed it today. Here at CSU, we have dedicated nurse advisors, nurse counselors. We all speak the nursing language, and we need those to help support. We support so many. To support us through our academic journey, to make it seamless and easy for us to understand. And that's why at CSU that we've invested in nursing in every level, in every field, because it shouldn't be difficult. It shouldn't be a barrier to figure out how to get into school or how do I log into the class. We've got you.
That's
We'll
great.
take care of you.
That's awesome.
And when we look at resources and finances, CSU has done a really good job in building in the resources. The textbook is built into the course. It's part of the course. It's not an extra expense. It's part of
That's great.
the package. And things like Shadow Health and MetaTracks, which are external resources, technology resources that enhance learning. They're all part of the package, which really makes it easier for getting the financial aid and processing the paperwork and managing your budget all at the same time.
Right.
Yeah, there's no hidden cost. When we talk about, well, we got to do a budget at home. I need to budget. Can I afford this without sacrificing my lives or my, food on my table? And there's no hidden cost at CSU. It is what it is, and we shouldn't let textbooks, MetaTracks, Shadow Health be a barrier. We pay for it for you. It's part of your tuition. So you don't have to think, oh, I've got to come up with $100 this month to get a textbook. It's already covered, and we'll ship it to you for free.
That's awesome.
Wow.
Having that transparency to know up front, this is what your expectations are. That's great.
That is important.
Couldn't agree more with that. I mean, we've all gone to school and furthered our education, and that is important. Like, can I afford this? Is
Right.
this what's the ROI on me?
Yep.
Am I investing in myself? I don't. I want to be able to invest and do that.